So in today's session for mental health, we're going to look at the general nursing management of mental health and psychiatric condition. So this is just the general management which you can use in some of the mental health conditions. And you're of course talking about maybe schizophrenia, mania, dementia, depression, aggressive patients. So these are some of the examples of conditions where you can use the general nursing care, but of course you are starting from medical management and then you come to the nursing care. So this is the nursing care that you can use, and we'll go straight into the management itself. So when it comes to the management for mental health, so just like any other management, the first thing that you need to start with are the aims. So for example, in terms of the aims, you can say to promote a quick recovery. You can talk about to promote comfort, to prevent suicidal ideation, for example. You can say to promote the good nutritional status. The other one, you can say to promote a good nurse-patient relationship. So at least 4 aims or objectives, and these are examples of aims that you can have. Then from there, the first heading is nurse-patient therapeutic relationship. So on this heading, the first point you can say, I will explain my role as a nurse and that I wish them to recover to promote cooperation. So the first thing, as you attend to this patient who's mentally ill, assure them of your role that you have towards them, and then you wish them to recover so that they can even be cooperative once you assure them of that. Then apart from that, the other point you can say, I will be non-judgmental to my patient to promote the nurse-patient relationship. The other point you can say, I will actively listen to my patient's complaints and advise appropriately to promote the nurse-patient relationship. The other point, among others, you can also say, I will avoid whispering in front of my patient to prevent suspicions or paranoid. You don't whisper when you are in a mental facility, or when you are talking, you are whispering between you and your fellow medical practitioner. The mentally sick patient will think as though you are talking about them, and that makes them easily become agitative. The other point that you can say, I will minimize eye contact to my patient to prevent triggering aggression. Then the other point, of course, among others, you can say, I will give praise on good behavior that the patient portrays to promote continuity or recovery. And then the last one, among other points, of course, you can say, I will greet the patient always when I report for work to promote the nurse-patient relationship. So those are some of the points that you can have on nurse-patient therapeutic relationship. Then the next point is safe environment. So on safe environment, you can say, I'll nurse the patient in an environment which does not have any sharp instruments or hazardous instruments which may cause harm to self or others. That's the first point. Of course, you're nursing the patient in a mental health facility, but the actual environment should not have any sharp instruments. Then the other point you can say, I will seclude the patient from all other patients to prevent injuries to others if they have aggressive behavior. Then apart from that, you can say, I will nurse the patient in non-slippery floor to prevent falls that may cause injuries. And of course, you can say, I will nurse the patient in a clean environment to prevent nosocomial infections. And of course, the other points you can say, I will nurse the patient in a well-lit environment for easy observation. The other point, among others, you can also add on to say, I will nurse the patient in a dim light environment to prevent visual hallucinations. Then you can add on to say, I will nurse the patient in a noise-free environment to prevent triggering aggression and promote rest. So there are many other points as well that you can still add on environment, also such as nursing the patient in an environment with no naked wires to prevent electrical shock. So you shouldn't get stuck. At least whenever you are answering a question on environment, reach a minimum of 5 points, not less than 5, but at least a minimum of 5, just for you to get at least maximum marks. The other point on the same environment that you can have, we can also talk about removing all the shoelaces, belts, long-sleeved shirts, as this will be done to prevent suicidal ideation or attempts. So you remove all these within the environment. And you can also talk about nursing the patient in a lockable seclusion environment when the patient shows aggressive or psychotic behavior, and this promotes safety. So once you talk about those and any other point, then the next heading is observation. So under observation, the first point, of course, you can say, I will check for the vital signs such as temperature to rule out hyperthermia or hypothermia. Then apart from that, blood pressure and pulse to rule out cardiopulmonary failure or cardiovascular failure. You can also talk about checking the respirations to rule out dyspnea. Then apart from that, you can say I'll observe the mental state of the patient using a mental state examination strategy to rate the patient's well-being. Then you can also talk about observing for visual hallucinations to monitor the progress of the patient to medications. Apart from that, you can also say I observe for the side effects of the patient's drug to monitor the patient's progress, and I will intervene appropriately. Other points, rather, among others, you can say I observe for aggressive behavior and I will intervene appropriately to promote the patient's quick recovery. You can also say I observe for the feeding pattern of the patient to monitor the patient's condition and promote good nutrition. The other point, of course, you can say I observe for social withdrawals of the patient to prevent suicidal ideation. And the last point, among others, you can say I will observe the sleeping pattern of the patient to rule out insomnia. So those and many other points will still apply, and then the next heading is psychological care. So on psychological care, again, you can say I'll explain the patient's condition in simple terms to both the patient and the relatives to promote cooperation. You can also say I'll always get consent before touching the patient, as this can be perceived as a feeling of attack. So when you tell them to say I'm about to get some blood or I'm about to inject you this drug, they will be aware and not be defensive. The other point, you can say I will explain all procedures to be done to promote cooperation. You can also say I will explain the side effects of the drug to the patient so as to promote cooperation. You can also say I'll explain the rules of the ward to the patient, mostly about fighting as well as on the desirable behavior and the need to avoid any behavior that may cause punishment, and of course reward desirable behavior. Then the next heading is maintenance of good sleeping pattern. So on maintenance of good sleeping pattern, this is important in mentally sick individuals because they would rarely sleep, especially if they have hallucinations or whether visual, auditory, or whatever, or maybe they are in any psychotic state. They may have a disturbed sleeping pattern. So that's why you need to talk about maintenance of good sleeping pattern. So the first point here, you can say I will advise the patient to exercise during daytime so as to allow enough time of rest in the night. Then you can also say I will advise the patient to avoid taking any caffeinated drinks at bedtime to promote rest. You can also say I will perform bed making to prevent irritations during sleep. You can also talk about removing any noise from the environment to promote rest. The other point, of course, you can say I'll make sure that the light is dim to promote rest. You can also say I'll administer prescribed hypnotic drugs, for example, temazepam or coralazepam to promote rest. You can also say I'll perform my nursing care in blocks, or I'll perform related procedures in blocks to promote enough time of rest. You can also say I'll take all the squeaking trolleys for maintenance to have them oiled to prevent noise. And the last point, among others, you can say I'll encourage the patient not to take any fluids during bedtime to prevent disturbance or frequent micturition, which can disturb rest. So those are some of the points that you can have. And then the next heading is group therapy. So in group therapy, you'll find that this is just a form of psychotherapy which one or more therapists treat a small group of clients together as a group. So here you just say, I'll ensure that the patients are being treated in a group of individuals. This may promote recovery, as this can promote recovery. Then apart from that, you can say, I will ensure that the patient attends group therapy, as this can promote development of communication skills as well as socialization skills, and this also helps the client learn how to express their issues. Then apart from that, you can say I will allow the patient to attend group therapies, as this allows individuals to develop self-awareness and also the ability to listen to others with similar issues. So those are the points that you talk about on group therapy. Then the next one is family therapy. Now, when you talk about family therapy, here you now involve family members, and the family members should be educated on the patient's condition so as to accept the condition that the patient has, because in the patient themselves is part of their family, so the family needs to accept the condition, and this also reduces on stigma. So here you are going to say, I will ensure that the family is educated about the patient's condition so as to accept the patient back into their family and reduce stigma. Apart from that, you can say, I'll educate the patient's condition to the family to promote cooperation. Then the other point, of course, you can say, I will also involve the significant others in the plan of care, as this will promote cooperation and this can promote a quick recovery. Remember, patients, especially depressive patients who are not even being seen by their family members, the recovery may be delayed because they will feel unwanted and therefore they feel isolated, and they will have no need to recover and go back home. And this is one of the cause of course, institutionalization. Okay, the next heading is behavior therapy. So on behavior therapy, you can say I will set limits on all interactions and behavior so as to promote proper recovery. For example, on limit setting, you talk about what cannot be done for the client and also what the client can do, and the things they cannot do as well, so that they know where to end, rather than just leaving it open and allowing them to do whatever they want. Then apart from that, you can say I'll use reinforcing techniques and consequences to achieve the desired cause. Then of course you can say I will reinforce with something concrete that is readily available, because materials rather than emotional reward are preferred. Then the other point, you can of course say I will discourage behaviors in the patients at all costs, or bad behaviors rather in the patients at all costs. And of course, you can say I will reward good behavior and also punish undesirable behavior. So these are some of the points that you can have on behavioral therapy. Then the next heading is occupational therapy. So on occupational therapy, this one mainly focuses on helping mental health patients with a physical, sensory, or cognitive disability so that they can become as independent as possible in all areas of their lives. So here you can have points such as I will train the patient on their survival skills because they may not continue with their current employment. And then apart from that, you can say I will help patients of all ages to improve on their abilities on performing tasks of daily living as well as the working environment. So those are some of the points, of course, among others that you can have on occupational therapy. Then the next heading is recreational therapy. So in recreational therapy here, you can say I will use a variety of modalities, including arts, crafts, drama, music, dance, sports, games, as well as community outings to help the patient maintain or improve on their physical, social, or emotional well-being. So those points will help on recreational therapy. Then you go to nutrition. So on nutrition here, you say I'll give small frequent meals to promote good nutritional status. You can also say I'll give the patient meals together with others to promote appetite and prevent suspicion, because mentally sick patients will become suspicious just because you have given them foods that they're eating alone or foods that you are also not partaking in eating. They will think you have poisoned them, especially those with delusions. Then apart from that, the other point you can say, if the patient is manic, I will give food strategically to the places that the patient always likes to pass by. Then apart from that, you can say I will ask the patient and relative for their favorite meals so as to promote appetite, and this will improve nutrition. Then apart from that, you can say I will give nutritious meals containing carbohydrates for energy, vitamins to boost the immune system, roughage to prevent constipation, and proteins to repair worn out tissue. Then from there you go to hygiene. So on hygiene, what points can you talk about? Here, the first point you can say I will damp dust the patient's unit to prevent nosocomial infections. You can also say I will remove and change soiled linen to prevent nosocomial infections and promote comfort. You can also say I will observe all sterile techniques in my nursing procedures to prevent contamination or patient contracting any infections. Then apart from that, you can just say I will ensure that the patient is taking frequent baths so as to promote hygiene. You can also talk about performing nail care to prevent nails from harboring microorganisms. You can also talk about performing hair care to prevent lice or pediculosis, and also this also improves self-esteem. Apart from that, you can say I will assist the patient on how to make their own bed to promote good grooming and also enhance behavior. So these are some of the points among others that you can have on this heading. The next heading is effective communication. So on effective communication, here the first point you can say, I will speak in a non-provoking manner to prevent aggression. You can also say I'll avoid making eye contact on the patient to prevent exhibiting aggressive behavior. And then apart from that, the other point, of course, that you can have is speaking in a low tone voice so as to promote cooperation. You can also use sign language if the patient is unable to hear you, so as to develop effective communication skills. You can also use diagrams so as to effectively communicate to the patient. Then from there, the other one is behavior modification. So on behavior modification, here you need to teach the patient on certain behavioral performances so that you modify or enhance their behavior. So here some of the points that you can have. You can say, I'll teach the patient acceptable behavior in the word to enhance behavioral modification. You can also say, I'll give praise and gifts whenever the patient does something that is good to promote continuity. You can also talk about involving the patient in social skill groups to impart good behavior modification. Then from there, the next heading is, of course, social skill training, because a patient who's mentally sick, they will need social skill training just for them to be socially integrated. So the first point under social skill training, you can say, I'll teach the patient on how to live with others in the society. For example, how to greet and respect elders so as to promote good social skills. Then apart from that, you can say, I'll teach the patient on how to maintain relationships, interpersonal relationships in the society to promote social skills. You can also talk about teaching the patient to hold a conversation in a social manner to promote good social skills. Apart from that, you can say, I'll teach the patient on how to handle themselves when upset to prevent exhibiting aggressive behaviors to others, because aggressive behaviors may disturb or impair social skills. Then the next heading, of course, is assertive training. So assertive training here, you can just say, I will teach the patient on appropriate assertive skills, such as saying no to unreasonable requests without hurting others' feelings. And this is done to promote assertiveness. Then apart from that, there is stress management, which is very important as well. And here you can say, I'll teach the patient on stress management skills, such as playing soccer, watching TV, so as to relieve stress. Sometimes you can also teach the patient just to take deep breaths and hold a bit, and this is also done to relieve stress. So stress management is very important, especially to aggressive patients. And then the last point, or the last heading, of course, is the discharge plan. So in discharge plan here, you're going to say, as soon as the patient is admitted to the ward, I will tell the patient that they will be discharged and join their family or friends to rule out institutionalization. Apart from that, you can also say, I will begin the discharge plan on the day of admission, so as to also integrate the family in the discharge plan. So those are some of the points that you can talk about on discharge plan. But of course, you can also ensure that you observe whether the caretaker is able to effectively manage the mentally sick patient at home before you discharge them. Because if they are not able to take good care of them at home, they may be back in the streets, or they may be injured or hurt, because other people may not be aware that this patient is mentally sick. So when we talk of the general nursing management that you can use for mental health, this is something easy that you can use, but of course it will depend on each condition where you are starting from, whether you need to talk about drugs and also the nursing management. So for today's session, we'll end here. Until next time, goodbye.